so they did it at the outside courts at Bishop, is my understanding.
So it's 4 o'clock, we have a quorum, so I'm going to go ahead and call the meeting to order. If the clerk will call the roll. Here.
Do we have?
Here. And since I forgot to do this before you read the roll, I will do this now, that any member of the public wishing to be heard shall complete a physical or virtual comment card and present the card to the clerk of the trust prior to the start of the board meeting. Members of the public recognized by the chair will have 3 minutes to speak on a single subject matter submitted on their comment card presented prior to the start of the meeting, and the clerk of the trust will function as the official timekeeper. Do we have any board members wishing to participate virtually today, Ashley? Okay. So we do have a quorum physically present. Is there any reason that there's an extraordinary circumstance that would allow a board member to participate by electronic means? Has anyone declared such? No. So then basically we are voting as usual. The people physically present can vote. Those not physically present can not vote, but can be heard in terms of their opinion as to the issues. All right. Then that brings us to agenda review, revision, and approval. So we have a motion to approve the agenda, including the items listed on the consent agenda.
So moved.
Any changes? No? If not, then a motion to approve the agenda, please. I have a motion and a second. Is there any public comment on the agenda? Being none, back to the board. All in favor signify by saying aye.
Aye.
Any opposed? All right, thank you. Any general public comment? No cards have been filed, so that moves us to my report. So the executive director search update. We have at this point 17 applicants. I've not looked at any of the applications at this point. They've all gone to Ms. Howard, which is where they're being submitted. But it will close this Friday, the 13th. And so after that, we will do what we agreed to at the last meeting, which is go through, identify those that meet the minimum qualifications, send them a written pre-screen. I also believe that Mr. Swain has completed a draft of the contract for the Alachua County HR assistant. Almost. We have agreed the rate is just a little over $82 an hour, and we've set a cap of $5,000 on that agreement. Both Ms. Akpan and I think that that's adequate and should be able to complete the task within that amount. So that's where we are with the search. And that, any questions about that? Yes, ma'am.
I had a question. I was reading in the minutes, and I saw the rate that we talked about for Ms. Akpan. And then I saw, was it $250 an hour for CRI?
No, it's not CRI. That's James Moore.
James Moore, okay.
Yeah,
I'm
that's
sorry.
the grade she had brought forward when they said that the search was above and beyond their standard duties and under the scope of what they had, and we agreed to that rate, and we're trying to minimize the amount of time. She should have very little this month because it's been pretty much a hiatus while we wait for applications to come in.
And in her doing that, she's just forwarding those apps to you, and
She's part of the review team.
Okay.
Yeah, she'll be part of the review team. We figured 3 people made more sense than not. So. Any other questions? Okay, then that brings us to the executive director's report. Christy?
Thank you. Just a few updates, different projects, activities we've been working on at the Trust. Our first cohort of 13 Alachua County Early Learning Centers have completed the Business Leadership Institute for Early Learning Masterclass. It's a series that explores the most important business concepts related to the industry of childcare. We had subject matter experts that facilitated each session covering finance, marketing, human resources, and real estate with the 13 centers. The owners and directors of those centers attended the classes one Saturday a month, February through May, and or February through April, maybe. There is also an online component that they participated in, and that series takes the participants through a curriculum of online training material and videos that reinforce everything they learned in the master classes. And now that the participants have completed the series, they are developing business plans that will be submitted to our contractor for the BLI contract, as well as our local SCORE, which many of you are aware of SCORE as a business counseling and mentoring organization that helps small businesses get off the ground to achieve their goals. All of the early learning centers will complete pre and post tests to assess their learning gains, as well as receive CEUs. Many of these centers will move forward with next steps to our Accreditation Academy, which is designed to increase the number of Gold Seal programs in Alachua County. Gold Seal accreditation offers the possibility for additional income, higher performance standards, as well as local real estate tax abatement and marketing distinctions for child care businesses. We intend to enroll 6 early learning centers in our Accreditation Academy, and we anticipate that this will bring or represent a 40% increase in Alachua County accredited child care businesses. And these programs represent about 243 school readiness subsidized slots for children in Alachua County. So we're excited about that. We've partnered with the Chamber. Our contractor BLI has done a really great job with this program. Mia is the lead for that service, and she did a lot of recruitment along with our contractors to ensure our providers were attending those monthly classes, and so we're really excited about the next step and the next phase for these early learning centers. I'll move on to our summer camp. School is ending here very soon, May 27th, and our CTAC funded summer camps will open their doors here shortly. And to help promote those summer camps and increase registration, Dan worked closely with WCJB to create a summer camp promotional video that has been running the beginning of April, and it'll continue through May. It has been on our social media platforms as well as our website, and we have received a lot of traction from that video. You'll hear a lot more from Liz today during her presentation about the different strategies we are using to promote and highlight the good work that the Trust is doing in our activities. Also, I just wanted to remind everyone that at the next meeting, the May 23rd meeting, Nicole and I will be presenting the a preliminary budget for fiscal year 23. That concludes my Executive Director's report.
Thank you. Any questions for Christy? Commissioner Cornell.
Thank you, Madam Chair. Thank you, Madam Director, for that update. On page, so I'm on your tab, your area. On page 43, the board request, it looks like you had a meeting with Ms. Kitchens on May 3rd. Could you give us just a brief update on how that went?
So Mia and I had a meeting with Sherry with CAC just to talk a little bit about the program and the services that she's offering. We're very interested in hearing more about the wait list and the services that families and children needed from her program. The outcome of that meeting was that Sherry is going to keep us posted on the grant that she has written with United Way. Within that grant, she has asked United Way to fund a few positions that will will address that wait list. And if fully funded, she will be able to remove the children from that wait list. I asked her to keep us posted in case she is not fully funded, so that I could then come back to the board to talk a little bit about the potential of mental health services, or how and if the board wanted to move forward with that, as it was brought up at the last meeting.
Okay, thank you. Also, on page 31, so members, this is my favorite sheet, the page 30 and 31 sheet. I just wanted to note that at the bottom of page 31, that's our Teens Work program. And on Saturday, I was able to attend, at least for the tail end, the Minority Business Listings Job Fair with a number of the vendors that they're working and children that they're looking to get applications in for summer work. And I just thought it was really well attended. I know Christy and some of her staff were there, so thank you for being there. I did also note that they had invited Goodwill, who is our other provider, so they are being very, very inclusive, and I'm anxious to see kind of how the results of those two feed out. And then the last thing I wanted to just note for you members on page 41, at the top of the page, I'd be remiss if I didn't recognize Tina Certain is named President-elect for the Florida School Board Association on April 19, 2022 in your report. So thanks for noting that, and Tina, congratulations. Kind of a big deal. Okay, thank you.
You're welcome. Any other questions or comments? And I did just receive a text that it's hard to hear us on Zoom, so I'm hoping maybe, I don't know if we lean into the mics a little bit, but just to point that out. I'm not sure there's anything we can do about it at this point, and we try as we might, but yes, ma'am.
Thank you. And Dr. Hart is not with us, but I did want to, I read her article on here, and I just wanted to kind of reiterate a quote that is on here that I have shared with our superintendent that I think is really important. It's on page 59, and Dr. Hart says, "We tend to think in terms of program, but policy changes really make the sustainable gains." And I think that's in anything. It's not the next latest and greatest program or software as it relates to school. It is really policy changes, because it's policies a lot of times, and the way we do business and the way we operate is kind of what has got us in this quagmire, so to speak. But this was a really good article of hers being the graduation speaker at her alumni to future doctors that are headed out to the next phase of their career. But I thought that was there. I just wanted to highlight that.
Thank you. Anything else? Okay. All right. That brings us to the Data Technical Advisory Committee update. Ms. Wagner.
On April 28th, we had our second Data Technical Advisory Committee. We had full participation of all members and our 2 board members as leads. What we talked about was data strategy. We talked about the data that we're collecting now at the Trust and where we aspire to be, how the data that we collect is connected with our goals, and that the data that we're collecting each has a purpose for why we're collecting it, that it's connected with our goals and our strategies. We also talked a bit about how we gather information. We talked a lot about the advantages of having a data system, which we do not yet have. And we talked about the importance of tracking individuals over time and across programs, the ability to make linkages with other systems as well. And with that, our next meeting will continue to talk more about data sharing and a bit more about a consent process. Our next meeting is on May 26th. And I just want to open it up to Member Pinkeson and Andrew to see if they had any feedback on the meeting or anything they'd like to share.
Any other feedback from committee members?
No.
Questions from board members, comments?
That was comprehensive.
All right.
We got off into the weeds quite a bit, so I think that keeps it on track.
I think
That was the point of that committee, getting into those weeds.
I think we made some progress. I don't think we got as far as Bonnie would have liked to have gone, but that's the chair's fault. So that would be me. But what's great is it seems like everybody's kind of on the same page, and that's
Excellent.
encouraging.
Excellent. All right.
That everybody was there.
Okay. Thank you. Steering committee update for the strategic plan. So this is a two-parter. Since Cheryl and I'm handing this completely off to Cheryl after this little bit. Christy and I met with Catherine Raymond. She's our consultant. We hope to engage for this part of our process. At your podium was an updated timeline as opposed to the one in the book, so this is what we're referring to. And I'll let Cheryl talk about that. I just wanted to say that I think that this is pretty comprehensive. The bottom line cost is right up there around $23,000, which is not uncommon for these kinds of activities. And I see this as part of what we really, going back to the need to do a broader assessment of where we are, where the community is. And so the next step will be the RFP for the listening piece, which I also think will be probably much more expensive than this part because it's much more detailed and involved. So we do need to approve this. I'm going to hand it over to Cheryl to talk about the timeline itself and what they've continued to discuss, but we will at the end of this need a motion to approve moving forward with a contract for Dr. Raymond.
Okay. Christy and I also met with Ms. Raymond.
Mike,
Pardon?
talking to your mic.
Okay. Can you hear me? Yes. Okay. Christy and I also met with Catherine Raymond on Friday, May 6th, and really it was to discuss the timeline as it stood, and then also, the listening project, the dates to award the contract, and then the dates to complete that so that we could move forward into strategic planning. And we agreed that Christy and I will have the ITN and the scope of work completed by May 18th, the draft of that. And then we are going to send that out to the steering committee and then have the steering committee meet around probably on May 25th so that you all can have input on what we've put together. The whole group will have a chance to have their say on the draft. And if we can get that final draft put together, we would like to present that for the board on the June 13th, have that ready on June 13th for approval, and then be released on June 17th. So that's the timeline to at least get that out to the public. And when we looked at the full timeline, which was the second handout you have, really the changes are happening in the middle as far as the time to get the listening project done. We're trying to make it a more reasonable timeline so that we're not scaring off potential bidders, which it was a very tight timeline before. So we have moved some of the dates around in the middle. It moves the actual listening project to happen between September and October. And then the initial trend report, as far as what they're seeing on initial results, will come back to the board. Let me see which date it is. It will be in the month of November, but with those initial data points that they can provide, it won't be the final report, but Catherine feels very confident with that. We can actually start moving forward with our strategic planning. So once we start the strategic planning, the only thing at the tail end that will happen is instead of the final plan being presented to the board in February, it will actually be in March now. But we felt like this was a more doable timeline. And again, we can discuss this in more detail if anybody has any questions.
Questions? Commissioner Cornell.
Thank you, Madam Chair. So I guess for Ms. Goldwire, so it says ITN, and I know you were going to get some other trust examples. Are we doing an ITN, invitation to negotiate, or are we going to do a request for proposal where we're actually laying out what we expect?
When Maggie and I, or Chair Labarter and I spoke to Catherine, we decided to go with an ITN. Within the ITN, we'll state what it is we are looking for, but allow the individuals responding to that ITN to provide us with the details of how they would actually get it done. We still are able to use the examples that were provided to us to help guide what we are looking for and guide the narrative, as well as the evaluation criteria, but it'll be an invitation to negotiate.
Okay, and with the majority of the work being in August and then September and October, and have we set a preliminary budget for what we were expecting?
We had not. When Christy and I talked to Dr. Raymond, her feeling was that it would be probably in the neighborhood of 40,000, if not a little bit more.
50,000.
And when I think back again to the earlier discussions about a needs assessment, we were talking about 70 to 80,000 for that, so I'm not surprised that that would be the ballpark we would land in for the whole, especially since one of the things we're talking about is making sure that we include communities, as well as disability groups, as well as providers, and I think that we have a lot of ground to cover. And so I think that it's not, I agree that the time change is reasonable, as well as what I think the cost will come in at.
And the draft ITN will come to the steering committee at the June 13th or at the end of the May?
Come to the board at June 13th.
June 13th, so in May 20th is when we'll look at it and see if there's things that we want to add. When that happens, could I ask that you provide us with some of the other ones that around the state that you kind of use to develop it?
Yes, I can provide copies to the committee.
Okay, thank you so much. Thank you, Madam Chair.
You're welcome. And others? Do Dr. Hart or Dr. Colesmith have any input, comments before we, okay, can you, which one? All right, Dr. Hart? If she can hear us. Yeah. I don't know. Do we have Dr. Hart?
She was on screen. And then
She was a
changed
minute
the video.
ago, and now it's not on there.
Hi,
Is that you, Dr. Hart?
can anybody hear me? I'm trying to,
Yes, we can hear you.
Yes.
You're on. Yes, ma'am.
unmuted. I have video. Can anybody hear me?
Yes.
Hello?
I'm trying. Yes, we can hear you.
I'm here, but I can't hear myself too well. Sorry, I would love to have a comment, but I can't hear a thing, so I'm still working with Chris,
Okay. We'll come back. Any other comments on this? Since all right, so right now the only thing before you for approval or not is the agreement with Dr. Raymond at the rate that she has quoted us, which is I think not substantially going to be different than what was in the backup documentation behind tab 10, which is, I'm trying to get to
23,440.
23,000, yeah,
Plus travel.
400 plus travel. And she did, as you'll see, a lot of the meetings she envisioned doing virtually so that there wouldn't be travel for all of the times that she would need to be here. I think she particularly thinks it's important anytime she meets with the board or the broader group that she be here, but I think she will manage that as efficiently as possible. So
I move with staff recommendation.
Second.
we have a motion and a second. Do we have any other board question or comment? Any public comment? Dr. Hart, do you think you can chime in now? No. See if she wants to submit a comment to the chat, or if it's more lengthy than she can do via chat. Before we take a vote, I would just like her input since she. I have a motion. She's trying hard.
There's like a delay.
Yeah.
Seems like I can hear it.
Ashley, anything? I think. Is there anything in chat? In the chat? Okay. She's typing. Okay. She cannot, that's true. All right. All right, then back to the board. Everyone in favor of the motion that we go ahead and finalize an agreement with Dr. Raymond, signify by saying aye.
Aye.
Any opposed? Okay, thank you. And Cheryl, we look forward to the rest of this, and Christy, the work on it. So our next item on the agenda is a presentation by Liz on our community engagement and promotion efforts. So Ms. Kaysen.
There you go.
Sorry about that, a little bit of technical difficulties. So good afternoon, I'm Elizabeth Kaysen. I'm the Community Engagement Coordinator. So for today's presentation, we wanted to provide some information about how we're sharing information about community engagement and how we're keeping the community informed. This is just a snapshot. We're doing a lot of things, but it's just, keep that in mind. So, community engagement. You may ask yourself, why is this important? We think community engagement is important because we need to communicate to the public information about our programs. We need to make those connections, and we need to cultivate those relationships, especially across our diverse communities. We engage with our residents, stakeholders, and interested parties for Children's Trust to build stronger and trusting relationships between our funded organizations, our funded organizations and our residents and families residing in Alachua County. So there are a number of ways that we are accomplishing these communication efforts. So first, we are meeting with our staff internally to ask them, how are we going to share information out in the community? So we are designing and creating flyers, we're creating brochures and marketing pieces specific to those target audiences. We're intentionally working on this and making sure that we are inclusive of equity across for families so that they can access information. We're also considering translating information in Spanish because we're actually hearing from more Hispanic and Latino families. And a lot of this we can do in-house with the translation because I do speak Spanish and can translate information. And we all are also working with the Rural Women's Health Group, and they are on board with helping us translate information and get information out of our programs and services out to their families, and they actually have 700 families that they are currently working with. So when we're looking at our internal outreach, we're continuing to have Zoom meetings. We are sharing information with several different agencies. Because of Zoom, because of COVID, we are still having to meet via Zoom. And we are sharing information regarding bringing awareness through our email campaigns. We're sending out flyers and brochures and newsletters through the email campaigns. When we're looking at external outreach events, we are attending a number of outreach through our health and wellness events. We are actually attending a number of tabling events and community fairs. We distribute a number of marketing materials and information to families to inform them about our programs and services. And mostly right now, we're really pushing the after-school programs, the camps, and TeenWorks Alachua information. We are connecting with families from everyday walks of life, and a lot of these families are dealing with a lot of challenges. So as you can imagine, we're really trying to be intentional on how we're messaging the information. We are attending a number of businesses and civic groups and social gatherings, which include early events, evening events, weekend events. As you can imagine, we are up all hours, and we are everywhere throughout the county. We're attending the Gainesville Black Professionals group. We're going to Rotaries. We're going to the Kiwanis, the Rotary clubs, the civic clubs that are all across the county. So we are really, community engagement for us is not just an 8 to 5 job. So we are also members of a number of Chamber of Commerces. We are members of the Alachua Chamber, Hawthorne Chamber, High Springs, Newberry, and Greater Gainesville Chamber. And this is offering the Children's Trust opportunities to network with those businesses in those particular areas. We are also building relationships with churches and the ministerial associations, and we are continuing to engage with the municipalities. One of the things that I heard early on when I first started was that in the rural communities, a lot of the rural community folks felt that when people wanted the trust to be created, they went to the rural communities for support. Once the referendum passed, they never returned. Never got any solicitation from input on rural communities. So one of the things that we devised early on was that we actually went before every municipality to make sure that we provided them an update about the Children's Trust, what we were funding, and the services that we were providing within those communities. And Trust Member Pinkinson went to a lot of those meetings with us early on, and those meetings were actually very effective. And so that's one thing that we definitely need to keep in mind, that we need to continue to go out to those rural areas. Our legislative delegation, for Children's Week, we did get an opportunity to go to Tallahassee. I was able to schedule in-person sessions with all of our delegation. And that was really effective because we were able to meet with them in person and really talk about our initiatives and advocate for some of our programs. What came out of that was really great because Senator Perry has reached out to us, and he would like to meet with the Children's Trust ahead of next year's session so that he can have a strategy if there are issues that we want to bring before, so that he can advocate for us in Tallahassee. And if you'd like to keep in mind, after all of this, there's a small team here, but in the last 3 months, we've been able to go to 40 different locations in just 3 months. So we are really being visible, and we are very local. And for social media, this is a great way for us to communicate, engage with stakeholders in the community. To put it into perspective, there is research that shows that everybody in Alachua County has access to cell phones. According to the U.S. Census, 94% of residents in Alachua County have access to computers, and 85% have internet services. Now, this may be a little different for the rural communities, but that just lets us know that people do have cell phones and they are looking towards social media for information. When we use social media, we are promoting social media at events. We're sharing information mostly on Facebook, our Twitter, and Instagram. We have seen an increase in our engagement numbers when we use our social media, which is great. We are also seeing an increase in our Spanish engagement. So in case you haven't seen, you may, if you follow us on Twitter, you will see that we'll post a Twitter post in English, and then we'll turn around and post it in Spanish, and that has actually enlarged our reach for Spanish community. And please, if you're not following us on social media, please follow us, please like us, be our friends. It's important for us to get those engagements, but then you'll also see that we have a lot of followers now because we are actually, the engagement on social media is actually, we are very consistent now with social media. And I do want to show you just a few pictures of where we are in the community to give you an idea of the different types of events that we are attending. You all see staff, and you'll also see some of you all may be in some of those pictures, but these are pictures that we have posted on social media. So here you'll see some pictures of the chamber, folks at MLK breakfast, our very own Trust Twombly's on there at a Celebrate the Child event. We celebrated Rotary. We went to one of their events. President Brody was speaking at one of the Rotary clubs. We were actually able to add the Children's Trust on the Alachua County League of Cities meeting. They actually met in High Springs, which was great because that's Christy's hometown. And they really were pleased when she mentioned that. But all of the municipalities were represented there, and she did a really great job in really introducing the Children's Trust and talking about the different things that were happening with the Children's Trust, and they were just in awe, basically, of all the work that we are doing. So here we have a picture of the Episcopal Children's Services. Even though we do not fund them, this was a great opportunity to go and meet with their staff. They actually invited us to tour 3 of their locations, which was really nice. And now we're having ongoing conversations on how we can continue relationship building because, again, they're also helping families in our community. So here's a picture of another chamber in High Springs, one of our funded entities, the Good News Arts. For social media, we were able to promote the Comprehensive Women's Group. We actually went and had, for Safe Motherhood Initiative, went and met with their team, and it was great because we got a lot of engagement through social media. SWAG, we were in SWAG at one of their health fairs, and it was great because we were able to meet the famous Dorothy Benson. She was great and glad that we were there. And posted some really great feedback on the social media, sharing that we were there at the event. So that was really great. Kids were enjoying the event. And when we got to partner with some of our other funded providers there as well. This is just another event that we were at. And as you can see, the staff was very engaged. When we go to these events, we try to find out what the events are about and connect with them. They wanted us to dress up and there was a fitness event, and we went and we got involved with the family. One of our team members here took her son, and we were planting beans and showing the children how to plant these plants, and parents got involved, and it's just simple little ideas, but it's engaging with the families, and they have really enjoyed that we are out there in these events. You all may recognize some of these folks. Mr. Field asked Mia and I to take a picture, and so MB Listings, we wanted to make sure that we took a picture with him. Mia and took a picture with me as well with our trust member Ken Cornell, who stopped by our table. Trust member Certain, she came by as well, and this was the 42nd annual Fifth Avenue Arts Festival. They had a reception at night and then an event in the next day. And this event was one of the last ones that we did. We went to Hawthorne. Mayor Randall was there, and City Manager Wendy Sapp was there, and they were just very thankful of the Children's Trust. They could not thank us enough. They had a principal that showed up at that school, and they came to our table. She wanted me to meet all these different people, and they just kept saying, the Children's Trust. We got to thank the Children's Trust because they have brought the YMCA to Hawthorne. And so it's great because you want to hear that we're making a difference in these communities. So there's just some pictures there of the children. And I praise Christy today because, you know, this last picture of Mayor Gibb Cooper in the city of Alachua, we last week wanted to do a little something for Mother's Day, and we went to Alachua Elementary, and Principal Harbor allowed us to give out these little goodie bags to all the parents who were doing drop-off. And Mayor had his sign, and he was waving his sign, and he was so happy. The principal joined in. These families were just so thankful. And the amount of thanks that we have gotten on social media for this little event is amazing. So again, we're just trying to create opportunities where we can meet families and let them know that we are here for them. So next steps. Of course, I got my little wish list, so I got to try to throw something in here for you all to consider while the steering committee is coming up, and there's going to be some conversations. Again, as I mentioned earlier, our team is meeting on a regular basis, and we're talking about how can we promote events out in the community. So I'm hoping that at some point we can actually have videos where we can create some videos in different languages, talk about tips for parents, maybe possibly talk about evidence-based initiatives. If there's opportunities for us to host events, I'd like for us to do something, and we've already talked about some things. With Dion, I've reached out to him to see if there's something that we can do for fatherhood, and it's some type of fatherhood initiative for June. So maybe we can promote and provide some type of recognition for the families and the providers, one of our providers. Literacy events, summer is coming. We got to prepare for children. They need to make sure that there's opportunity for encouraging summer reading because they'll be out for a few months. So we want to make sure that we do something to encourage that. You all participate in the first annual Lights On After School to promote the after school, the importance of funding for after schools. So we do hope to do something for the second annual. We want to continue to partner with libraries. Also, Gainesville Housing Authority is open to meet with us. The school district, we want to hopefully play a stronger role, especially after Principal Harbor was just so open and willing to meet with us. So I think there's a lot of opportunities for us to continue to meet. Producing some short campaigns to introduce our providers. There's a number of things that we could be doing, and I think now that we're starting to really gear up in the activities that we're doing, we're partnering now more with hospitals. People are reaching out to us now, and so our colleges and universities, there are opportunities for us. So that's just on my wish list, but that is it.
Thank you very much. That's really informative. Do we have questions for Ms. Kaysen from the board? Any? I know we put together a budget for sponsorships where we would accept applications, but I don't believe we ever really put out a media budget. Is that correct, that there's no budget for us to produce media or to put out media?
No, we have a budget. We have a budget. There's about, I believe, $50,000 or $60,000 in there, and that's how we are able to put out promotional campaigns with that budget. So that is included in our budget.
Okay. And so the budget for next year will include some of the wish list?
Yes, it will, of course.
All right. Okay, thank you very, very much. The next item on our agenda is an update on evaluation and planning, Ms. Wagner. And that is the presentation. I'm sorry, I was thinking they were both here, but this is the PowerPoint was next to your packet for the meeting.
So for the evaluation and planning update, I wanted to give the board more of a look of what I'm up to and what the team is working on in programs for both supporting our evaluation strategy and getting us to our goals, and then also how we support providers and what we look at for performance evaluations, monitorings, and such. So the 2 questions addressed today will be how we can use data to strategically focus on our organizational goals. So that is both looking in terms of our programs, our strategies, and beyond, more at the community level. And then how are our providers being supported, assessed, and evaluated? So first, we want to turn to the strategic focus on our organizational goals and how data can support that. How we would like to be sharing information with stakeholders as it relates to our efforts, strategies, and goals. And so you guys are familiar with this visual, or at least I hope you remember it from a few board meetings ago. I had shared this one-pager and did a brief update on it. And it's supposed to be a one-pager and give a very high-level view of who we are funding, how many participants are being served by those efforts, but also how it's aligned and connected with the strategies and ultimately the goals that we aspire for our children in this community. But I also intended it to be something much more where you can see the high-level picture, but also that it could serve as a dashboard where you can click into it and see more details on demand at both the program level, the strategy level, and the community goals. So I wanted to kind of share that vision with you. It's not completely done yet, but I will show you kind of what I had in mind for it and how this could be a way to look into further what we are doing, and so you kind of know what's under the hood of what we work on day to day at the Trust. So just using Family Partner as an example, each one of our programs has a one-pager, or it's not one page, but it's a document that kind of summarizes who they are, what goal they're connected to, a program description, what's the target population. We'll look at the amount that they're funded, they're expended to date. And then we'll also, for each program, according to our results-based accountability model, we'll have program performance measures stated out, which are the same as the ones in their contract. For example, for Family Partner, which is a program that supports women prenatally, and we'll have the Family Partner meet with women in the OBGYN office. They'll try to ensure that they get their prenatal risk screenings completed. So all that will be tracked, and there will be performance measures, how much being reflective of the quantity of how much is being served, how well, looking at the level of engagement, the level of satisfaction, and those outcomes. Better offs will be, in what ways has the participant taken something from this? It won't be a long-term outcome, but it will be a short-term proximal or direct outcome of the program. For example, for Family Partner would be that those car seat installations, that those children will be better off because they will have a safely installed car seats. You'll see for this particular program that 2021 has all NAs because they weren't funded in 2021. But each program has something, has a performance measures filled out in this way to demonstrate kind of what the expectations are for in their contract for the how much, how well, and better off. We'll also do some highlights and an action plan for each provider. So that's what that section of the dashboard would look at. And it could look different. I mean, as we continue on, we might evolve it to include additional items. We might have it be focused more on snapshots or evaluations. But for right now, that's sort of how I envision just giving a little bit more detail on each program, on that side of the program. On the strategy side, that would be something where we could really develop more how we're working with community partners, how we're listening, how we're gathering input in the community in the areas related to strategy. And then on the goals side of the chart, I envision that could be more where we could look at data on our community level indicators. For example, this is babies born low birth weight, where we could look at the data at a community level, how Alachua County is doing on this indicator. And we see that in 2021, 10.4% of Alachua County babies were born low birth weight as compared to the state at 9%. So we see that the county is doing a bit worse on that outcome than as compared to the state. We could also disaggregate it by race to make sure that that racial equity and disparities, how those are forming or how those are playing out over time. Are they widening or becoming smaller? We could also pay attention to where the data looks in terms of zip codes. For low birth weight in particular, we see that the zip codes in the more yellowish colors, the 32641, the 32609, 32694, and 32601, we see that those areas particularly have a higher occurrence of low birth weight babies. And I'm showing this as a demonstration to see what we can kind of look at at all levels, at the community level, then at the strategy level and the program level. So this is something that I've been working on and thinking about, and how do we look at data at all levels, and how do we create a plan where we can sort of share this information with our providers internally to kind of inform our planning, so we can have strategies aligned with what the data says would best get us towards our outcomes. So, and then in addition to just having the quantitative data, I think also knowing the needs, the resources, the strengths, and the will of the community is very important. So I also wanted to share a little bit about collective impact and how that information and how collective impact really has a role in this, because it is we are funding a lot of programs, but we also aren't the only ones working on these goals in our community. So it's very important that we also recognize the other players and have data in that collective impact mindset, where we can work with other sectors and systems, and then really have data being a piece where we can come together and hold ourselves accountable and track things and have those reinforcing activities in the common agenda, the continuous communication. The CSCs, they were obviously, based on the composition around the table, they were really crafted in a way where collective impact was, to have us be a coordinating body for children. And so I really see looking at this data, not only the quantitative stuff, but the stuff that we might gather with listening sessions, the qualitative data, the surveys that we might do with families at a broader level, that could inform our strategy and help us to better take action steps. One example that I can think of from my own previous is just looking at data. Once you start looking at data together with a team of folks, and you start tracking it like we used to track ages and stages questionnaire, which is a child development screening. And when we first started tracking it, was all over the place. There wasn't a lot of it happening. But once we started meeting regularly and looking at the numbers and talking about why it wasn't happening, the numbers went up dramatically. And then at one point, we were really seeing a much higher rates of screening, and much more children were receiving the developmental services that they needed as a result. So I really think that this is a strategy and a tool for our organization to start looking at data together with our partners. So that's kind of what my aspirations are in terms of the evaluation strategy and working with partners. Now turning to the second question, how are providers being supported, assessed, and evaluated? So that's more looking at our core or our center, and then that's a big component of what I do on the day-to-day, and I'm going to speak on my behalf, but also what my teammates are doing. And we all as a team really see our relationships with providers as a partnership, and we really want to see them be successful, because that's how we know we're going to be able to be successful as an organization as well. So on this slide, the visual displays the staff who have direct ongoing contact, but that's not to say that they might not have contact with Liz or Dan or Christy, but these are the four main staff roles that have contact with them. So there's Belita James and Dion Carruthers. They're our contract managers, and they are the primary point of contact for the providers. They provide a whole host of support on all aspects of the contract. They provide day-to-day support and technical assistance regarding their invoicing, contracting, making sure those necessary documents are getting submitted, the deliverables are getting in, troubleshooting any kind of issues that are affecting the programs, such as staffing, facilities, and much more. We have our fiscal assistant, Nicole. She provides support in all things fiscal and invoicing. Then there's me. I provide support all things data, all their performance measures, making sure their data collection is happening. If they need support finding an assessment tool, if we want to kind of vision what we want our performance measures to look like in years to come. And then there's Mia, our our early childhood system coordinator, who works with providers to convene them as a team, and along with external providers to work on issues facing children as a system. So for our Pritzker initiative and other initiatives she's starting to work on as well. So, and then to the right of this slide, there's what we basically do in overall is to monitor and provide support so our contract expectations are carried out. And this is a bulleted list of what general contract expectations would look like: administrative, fiscal, operations. The first 7 bullets up through data quality, those are ones that you saw in the renewal report last time. The last 4 are ones that could be considered in the future and that we might want to be mindful of, and that we are mindful of, but we haven't formally systematized looking at them. But then we will, as we continue to evolve, we'll continue to try to evolve our practices and look at things as we mature as an organization. How do we monitor programs? So monitoring varies based on the type of contract and service being provided, but this might be typical things that we would look at in the case of a child serving organization. We would look at, we would go out to the site, we would do a tour of the facility, determine environmental safety, review personnel records for background checks, safety credential or staff credentials. For example, if it's a counseling program, we want to make sure that the staff, if it specifies in the contract, they're supposed to have a training or a credential that they said credential is had. We'll want to observe the services in action to see if the staff ratios are what's in the contract that's being delivered as expected. And then more the document review and processes will look at eligibility verification according to contract, and that the data collection is as outlined in the data quality. It's consistent between what we're seeing submitted and what's actually on site. So our continuous quality improvement process, this is kind of from the start to the ongoing to kind of the end of the contract year. So in the beginning, when a contract is approved by the board, we'll have a contract negotiation and orientation meetings. Then after that point, it's sort of the door is open to have ongoing and regular communications via email, phone calls, any ad hoc meetings. Providers will also be submitting monthly invoices, reports, and data, so we'll have an opportunity to have kind of ongoing communications regarding those deliverables. The contract manager and myself will be completing site monitoring visits at least once or twice per year, depending on the stage of a program and how much they need. And then the providers will receive their monitoring results after their site visit, and they'll work with staff to address any areas of concern. And then at the end, towards the end of the contract year, we'll be doing provider reflection surveys where they can also tell us about how they feel that the year has gone, successes, challenges, and also give us feedback on how we've done as an organization to support them. So that's basically what our improvement process looks like, our quality improvement process with providers. So for implementation science, so this came, is anybody familiar with implementation science? Yes, I know you are. Okay. So implementation science is a way to help providers incorporate evidence-based practices or research-based practices is generally how it's used, but it's a good practice really for anybody who's implementing a program or an initiative and what the timeline I have on this slide, it was based on our last discussion about a policy of when to suggest a corrective action plan or improvement plan, on possibly also when to maybe terminate a contract. And to this end, I wanted to share the implementation science framework and tell a little bit more about it, since it's been a framework that's been identified as a best practice for effective program implementation in the human service field. So in this slide, it presents the 4 stages of implementation stages. Exploration, that's before the program even is contracted. That's us as an organization deciding we want to move forward with it. Installation is maybe that first year. Then there's the initial implementation phase, and then full implementation when they're regularly doing their work, and without any major changes. So what I see it as is looking like from our lens is for exploration phase, that would be when we are gathering community and board input about a program or initiative we're interested in maybe funding or bringing on. We would want to assess the community context. What other programs are existing in our community? Is there a need for it? Looking at existing models out there in the world, what are other people doing for said program that we're interested in, looking at the data and research. And then if we decide this is a good fit for us and we want to do it, we would release an RFP. In year 1, that would be that first year when programs come on, they would be doing their onboarding, they would be hiring all their staff, they'd be training all their staff. In this phase, the team and I would be doing a lot of support. It's a very heavy, intensive stage, and actually a lot of our programs are here right now, and so it is a lot more work in this phase. And measurement begins, but generally what you expect in this year 1 is baseline performance, because they are still onboarding staff. They haven't made the relationships in the community that Liz has mentioned is so important. And then after that first year, then they would start to go into improvement mode. They would get their data and they get their measurement down, they kind of see how they're doing on these measures, and then they would get continued support, and the measurement would continue. And then I would recommend in that first year that performance is scored, and obviously if there are any concerns, as I shared, the contract managers are continually addressing those issues, and as am I, providing support to get them where they need to be. That's what I would sort of go into that phase of in year, in that full implementation. Once they get there, again, it's continuous improvements, it's continued support, once they get to that full implementation, that would be maybe when we would start to look at possible outcome evaluation, because if we don't see parents are completing the program or children are completing the program, if the attendance is low, if those performance issues aren't happening the way they should be, it's not really appropriate to look at the outcome evaluation at that time. But I think certainly if there's a continued issue in performance in year 2 and 3, then certainly that might be something the board might want to look more at a policy. But the year 1, I think year 2, we do want to support our providers. If you recall in the board retreat, 37 providers don't even have a full-time staff. So these providers are they need some capacity building, and just the importance of building positive relationships is a cornerstone of implementation science and getting, ultimately building our providers up so children receive the services that they need. So when do we evaluate outcomes? That's a question that's come up a few times in board meetings. So I would throw out there as factors to consider certainly the stages of implementation. We want to see that they're in full implementation. The level of investment is important to look at. We're not going to have a $20,000 evaluation on a $10,000 program. And there's only one of me, and there's only so much we could look at in any given year. So we really, when it comes to outcomes, we want to be strategic in which ones we choose for a full evaluation. Organizational capacity is another factor. If the organization has a capacity to do its own evaluation, if the University of Florida already has an evaluation plan and they state that in the RFP, that's perfectly fine that if their organization has the capacity to conduct their own evaluation. Also, those with an existing evidence base might already have their own tools, their own frameworks, their own data system to evaluate. So in those cases might be situations where we don't want to evaluate, but the situations we would be our own locally developed programs, and certainly the ones that we are investing a lot of money in, and we have a lot of different providers that are working towards that could really use that support to confirm whether we want to continue with this strategy. So what's next? So I'm going to continue to work to fill out the pathway to improve child outcomes. We also want to start reporting out to the board by our 4 goal areas, kind of like a snapshot where we could look at each goal, both at the program, strategy, and community level to provide kind of information back on what we're doing and what's happening more on a community level. We will be definitely looking at our program performance measures across all our funded providers, and we'll be continuing evaluation planning support and collaboration. Obviously, you guys know the Data Technical Advisory Committee is ongoing, and we are going to be doing the steering committee and listening sessions. All of that will inform what our evaluation plan is as an organization. And hopefully, incorporating more participatory approaches and exploring data systems. So that's hopefully what's next for us. Are there any questions for me?
Questions? Okay, go ahead.
Gina, you want to go?
I had just one question. The first sheet that had the one-pager, is that active on the website, Bonnie?
No, but that is my vision, that it could be something that people can click into and see, like.
Okay, thank you.
We both went, ooh.
So a couple of things. First of all, Bonnie, I know you and I have had a lot of offline conversations, and I really appreciate everything that you and everyone is doing to pull together a comprehensive evaluation plan. I know it's very, very complicated. I think there are a couple of things that I think are important for me to share, if you don't mind, with the other members of the trust board. First of all, there are several hundred implementation science frameworks that are out in the real world. Like at last count, I think there were over 700, right? So I think it's really important, and you mentioned, and it shouldn't go we should underline it, that you all chose what are called the active implementation frameworks. That's actually the formal name of this one implementation science framework. It's known as the active implementation framework. And I think the reason, and what you said that I think is really important, is this framework has been used a lot in human services, where many of the other implementation science frameworks that are out there, not all of them, but many of them were used in public health and in health settings. So I think that's one important caveat. I think the other is the Children's Services Advisory Board actually talked about this framework when we were developing our 3 initial initiatives. I don't know if you remember those conversations, Cheryl, but we were trying to think about collective impact, right, with those initial RFAs, and both the Transformational Professional Development Initiative. If you go back and look at that initial RFA, you'll see references to the active implementation frameworks, and you'll see reference to the 3 drivers. There are 3 drivers, things that drive implementation in this framework, and they're listed here under initial implementation, the implementation drivers. The first one is competency drivers, and that's involved with selection of people who work in the program. So how you select people to get into the program, how you support people, train people, workshops, professional development, and then how you coach people. And the practice-based coaching framework that we installed was actually aligned with and is used in many contexts as part of the active implementation framework, okay? So what we tried to do with the TPD program is move the ELC to full implementation of coaching and workshops that support quality improvements, right, in the quality of childcare. And they're now hopefully going to sustain that and scale it up, right, as part of their regular, as you put, their regular way of doing business. So I think I just wanted to share that some of this has been here, right? It doesn't mean it doesn't need to get improved. It doesn't mean it has to get this particular framework. But I just think it's really important for everybody to know that there are investments that the trust has already made that are following this particular framework. It's not the only one, but the framework has been tried and tested a lot, right? Both at the local level, at the state level, and then nationally, okay? So I just wanted everyone to kind of understand, not a lecture on implementation science, but that there are mechanisms out there that we've been trying to think about these things. And I hope when our strategic planning opportunities are available, we can engage in more focused conversations about them as we move to other sites, other programs, et cetera.
I think that's all really useful. Others,
Reinvent the wheel.
right, no need to. Well, and everything has multiple frameworks you can approach it. And the challenge becomes not jumping from one to the other, because then you don't get anything done. So I think having a thread of continuity, you know, and I think this fits very nicely with the results-based accountability also. So I think that little bit of history was actually very helpful to me. So I appreciate it. Commissioner Cornell, your light is on. Is that a hint?
Yeah, no, thank you, Madam Chair, and thank you, Dr. Schneider. I don't know, Lee, how you felt, but hearing Pat kind of go through that history brought me right back to before there ever was a trust, and really, really thankful for the work that has been done, and Bonnie, for what you are now picking up and doing. My question, so great presentation, really excited to see it kind of coming to fruition, and I know that as we go through the strategic plan, you'll be really adding a lot of meat into this data. My question was, what is your, really what Member Shurton asked is, what is your kind of goal for getting that data dashboard, that third slide up on the website and completed, you know, internally, where we can start to share that with the public?
Well, I think it's important to communicate to the public what we're doing and the efforts we're funding. If somebody wanted to see about the programs we're funding in detail, that's all out there and transparent, that everyone could see, you know, what their taxpayer dollars are going into, but also, you know, to inform other partners and stakeholders in the community. Oh, the trust funds this, you know, and you know, that we can convene like minds to even propel the work more.
So is your goal to have that dashboard that shows, you know, the four goal: health, education, support, and safety, up with the strategies and the different programs that are supporting those strategies? Is your goal to have that up by the end of the summer, by the end of the year, or
I don't have a clear date in mind because I'd have to know about the web piece of it and how that could work. Like, I'm just using links from internal, it's in the local file. I don't know the technical aspects of that, so I'd have to research that a bit more.
Yeah, so I mean, I think that's a really important thing for us to ask our staff to be driving towards, because, we talk about, we have to say it a lot of times before the public hears it, but this healthy, educate, support, safety is something that I try to say every time I'm talking about the trust. And then backing into what are our strategies to achieve that, and then here are all our programs, which goes back to the sheet that I talk about, the how are we funding them, where are we putting those dollars. I think that's a great goal, and I'm really excited about the work that you're doing and able to share already, so thank you.
Thanks a lot. Other comments, questions? Any? Yep.
Pat, will you help me with, you gave us that information. Are you saying that what we're doing is good?
I'm saying that we have been doing some of this, not
Right.
all of it. And so what we've tried to do, I think, is really good, really good. And I think we're, on the right path in terms of selecting some frameworks. But frameworks in science is only as good as whether they work in the real world from my perspective, right? And so I think that we've seen proof of concept is what I'm trying to say, that it can work through some of the initiatives, right?
Okay.
I think the one thing that is ahead of us is to say, what is a program? Because a program isn't an implementation. A program, what's implemented in implementation in these frameworks are practices. So, for example, standard practices, and some of those are standard and some of them aren't, right? But like knowing what Sherry does, because she's sitting in the front, right? Sherry can tell you what the active ingredients are of what they're doing in their program, right? Those practices are what implementation is all about. It's taking either a set of practices or an intervention or a promotion, even an intervention that's at a community or promotive level, like the nurse home visitation program. We knew what was going to be done by those nurses, right, when they made the home visits. And then it was tweaked based on whether it was feasible to do it in an hour, whether it wasn't. It's a difficult concept, I think. It took me many, many years to wrap my head around it. But it's not the program per se, it's what's going on in the program. That's the focus of implementation.
Okay, thank you.
Almost like the curriculum, if you will,
Any other comments or questions? All right, so that brings us to, was there anything in the chat from Dr. Cole-Smith or Dr. Hart? Any?
Dr. Hart would like to say to Liz that this is exactly what we needed. Keep up the good work. And she also wanted to ask about whenever you go to places, ask people if they know about newborn and the program. And it's an entry point to the Children's Trust, and it's our chance to onboard families.
Thank you. All right, it is the time for board member comments. So I'm just gonna start at the, yes, I'm sorry. Pardon? Okay, sure.
Dr. Hart would also like to say, while she was in Roanoke, she learned about their CHIP program. The executive director would be willing to talk to us about what they do. She thinks they had about 420 families for wraparound services from conception to age 5, about 1.2 million for the whole household. They have a monthly visit from their workers who are perhaps social workers. They figured out the trust issue for the opioid families, and we could learn so much from them. So that's a request.
Okay. If she can send Christy some information about the program so that we can make the connection, I think that we can do that. Thank you. Commissioner Cornell? Mr. Andrews?
So I'd just like to echo, it really is about those processes and practices, and it's just, you mentioned like curriculum, just like teachers in the classroom, it's the providers. and it's the practices that they carry out. And so we can have great programs, but we have to have excellent providers and excellent teachers in our field to carry out the work. And so I think that's spot on. And then just a shout out for the translating to Espanol. I think that's wonderful, getting Spanish out there. We're working on that as a school district as well. And I know it's going to bear a lot of fruit in our community with our communication to those that reside here in Alachua County. So continue that excellent work as well. So just a lot of good news and great things going on, and I'm learning more every meeting. And a lot of this is definitely music to my ears. So just wanted to weigh in there. Thank you.
Thank you. Dr. Snyder? Okay. Member Certain?
I kind of sort of do. I want to ask Christy about, did you make contact with Mr. Hutchison, Todd Hutchison, with the county about the software going forward, you know, the transition? So is he planning to come to us? Did you have anything on the schedule for that?
So he did ask about whether he needed to come to this meeting or not. We had a meeting, Chair Labarter as well as Mr. Hutchison and some of his staff, and we discussed kind of our next steps, which included looking at the software and what that'll take for the trust, as well as moving forward with working on a position description for either a director of finance or a CFO, and he's going to be sharing those position descriptions with us for me to share back with Chair Labarter. And so all of that is in the works, but also including within that position the skill set to manage software implementation. And working closely with them as well. Madam Chair, is there anything you want to add to that?
I think the only thing I would add is that the transition for the county is not as imminent as it, so it's going to be a long implementation process, and what they were encouraging is that we develop basically our own relationship with the vendor in terms of support. They did feel like it was a really good support system at the vendor, and that we should be able to use that. So I think the takeaways for me were same as Christy, that let's get the positions in place and then migrate over as we need to with support from the vendor to do that. They felt all of that was doable. We got great advice around some of the skill set for that. So I feel like we're kind of in a place to start to move forward with that and make that transition, adding those two positions that we've talked about. Again, whether one's a CFO, I think they felt very strongly that that person could and should be the system administrator for the software. So that's where we're headed, and we'll have a proposal to bring back, and at that point we can certainly invite Mr. Hutchinson to speak. I think it's kind of not cooked enough yet for that.
That's fine. I want us to make sure that we're not leaving that
We're not.
on the side of the road there, given
We are not.
given our condition with the what came up with CRI last week. And Mr. Swain sent me, Attorney Swain sent me the contract with them and what we had and the deliverables from them. And I last time in the audit we heard from the partner from that, so I'm wondering if we're making any progress on resolving some things, because I heard a lot of things that they were doing almost as if it wasn't their responsibility, but when I was reading and the thing, it was their responsibility.
I think at some point we'll have a meeting with them to kind of clarify all of that, but I think right now we're kind of just get this laid out as a plan and be ready to move.
Okay. Sounds good. That's all I have.
Commissioner Cornell, did you signal that you wanted? Oh, sorry. Okay, so the only thing I want to mention is I had a phone call conversation with Chief Jones, who wanted to talk about youth mental health, and as I talked with him about, and we've talked here before that that's still an ongoing issue, I think, and I think it will be part of the strategic planning, certainly, and one of the provider groups that's going to be very critical to listen to. But I think that as we think about collective impact as a way of thinking through what can we do and who does what, there is not and never has really been a good inventory in the community of what's available. And at the same time, there's a flood of mental health money coming down through just about any system you can imagine is getting money to do mental health. And so I think that sooner rather than later, because by the time we are ready to put out any RFPs in that regard, it's going to be a little bit down the road. I think it would help to get together all of the possible providers in the community just so we have an understanding of who can do what with what. There's numerous types of pots of money that come through that have mental health. Schools have gotten some, mental health centers have gotten some, DCF has gotten some. Just about any entity you want to mention has got a pot of money. But they all come with restrictions on what they can be used for and for whom. And I think if we need a better understanding of that, and I think that that's part of what we ought to listen to. I know we talked about providers, but I think this is a particular group of providers that ought to be convened sooner rather than later. And I'm certainly happy to facilitate that conversation, having done it a little bit. But I think we need to do that. I think there is some sense of urgency. The chief certainly was very concerned about the amount of youth violence that he's seeing and the amount of trauma that's involved with those kids that have committed those acts. So I think we need to get that started.
I'm glad you had that conversation. I had a similar conversation with him at the Fatherhood event 2 weekends ago. Yeah, and I know that the city of Gainesville is dealing with that and GPD is dealing with that on literally a weekly basis. And with school getting out, I don't see that getting better. So I do think there is a definite sense of urgency, and also with what Ms. Kitchens contributed to us 2 meetings ago through the public comment with the pandemic and what we are seeing. So I'm very much in favor of increasing the funding and the programming in that Goal 1 sheet on that, that sheet. The sheet.
Yeah, I do think that there may be more money out there right now that can be better used if we can just figure out who's got what. Yeah. And so to start to work towards a collective goal as opposed to everybody in their silo doing what they do, what are the collective goals and how can we best use the resources that have flooded us right now?
I think you've talked about this repeatedly too, around promotion, prevention, and then intervention, and then crisis, because different pots of money and different needs at each of those levels.
And who will pay for what, when?
Who will pay for what, when, yeah.
All the counting on who will pay for what stuff.
All right. Any other comment from the board? If not, I do want to take a moment to point out that it is 5:28. And we are through to our agenda. We've already pointed out Dr. Hart's wonderful, the article. Our next meeting is Monday, May 23rd. It will be at the trust offices. I am praying, keeping fingers crossed, that we will have the owl to test at that meeting, but no promises. We don't know how orders are backed up or not.
So the county bought an owl too, and they had some real good response. I learned about it from you, but then when I went to the county, they got a couple of owls. So, yeah, good.
I think the school board needs an owl. I just want to let Ashley know now, I won't be at the next meeting, okay? I'll be away, so.
All right. There being no further business, we're adjourned. Thank you all.